So today the scenario will be a young woman coming in with rheumatoid arthritis. She's been dealing with the rheumatoid arthritis for a couple months. She's gonna get prescribed a new medication, and I'm just gonna walk you through that. Firstly, what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disorder causing chronic systemic inflammation, synovial membrane inflammation. You also have pain, stiffness that is more so associated in the morning time, um, swelling, and fatigue or tiredness. Complications of rheumatoid arthritis are disabilities, systemic effects, cardiovascular disease, nodules. The medication that the patient in this scenario is going to be receiving is methotrexate. And for a patient to receive methotrexate, the indications would be rheumatoid arthritis, psoriasis, cancer, chemotherapy, or Crohn's disease. The mechanisms of action: folic acid antagonist inhibits DNA synthesis, suppresses the immune response, slows joint degeneration, and progression of rheumatoid arthritis. You can give this by mouth, intramuscular, sub-Q injection, or through the IV. Side effects are typically nausea, vomiting, and stomatitis or tiredness. Adverse effects: bone marrow suppression, hepatotoxicity, pulmonary fibrosis, tetragenicity. Contraindications of this medication would be renal or hepatic failure, blood, dyscrasis, pregnancy, lactation, and don't drink when you take this medication. Hi, my name is Abby. I'm 37 years old. I've been dealing with my rheumatoid arthritis for like the past 3 months or so. It really has just started to flare up so bad. I was referred to you, this office, and I was told that you were the best person to come and see for giving me education about this medication that I'm about to be taking. I believe it's methotrexate. Hi, Abby. I'm Nurse Song, and yes, you will be prescribed methotrexate for your rheumatoid arthritis, which is a disease-modifying anti-rheumatic drug. Okay. So, as my nurse, I guess the question that I'm looking to ask is, what would your job be to ensure that, everything goes smooth while I'm taking this medication? Great question, Abby. So, as your nurse, I will monitor your CBC level, your LFTs, your pulmonary status. I'll assess for any signs and symptoms of infection because this medication does create an autoimmune response, which means it pretty much just lowers your autoimmune system. So you're more susceptible to getting like the common cold quicker than the average person with a strong immune system would. You said that you would be giving me folic acid. If you don't mind, I'm sorry to backtrack a little bit, but what exactly is the folic acid for? Another great question, Abby. So folic acid being prescribed to you is going to help to reduce the side effects without limiting the effectiveness of the medication. So like any GI upset or anything like that, the folic acid will help like you not have such severe symptoms if that were be the case. So it's more so of a preventative measure just to ensure that you're as comfortable as possible while taking this medication. I also would administer an antiemetic slash steroid combination, PRN, which just means as needed. That's if you needed it. It doesn't necessarily mean that in your case that you would need it. I also would keep an eye out on your bun and creatinine level, which is your renal function. Eyes and nose, I would assess you for any bruising, any form of bleeding, whether it be gums or anything like that. Just keep a close eye on you to make sure that everything is going well with the medication that you will be receiving. Fantastic. So, as your patient, what do I need to know as the one who is about to begin this new medication that I have no idea about? Like, I'd rather be safe than sorry, so like I want to know the ins and outs. Like, what can I do to keep me safe and do what's right by me? Abby, you're on a roll. So for you, absolutely no drinking with this medication. You want to avoid pregnancy for at least 6 months. Use contraceptives as needed. Yeah. You also want to just make sure that you have great oral hygiene. That when you are brushing your teeth, I said no drinking, so no alcohol in your mouthwash either. You also want to make sure that you're using a soft bristle toothbrush, because I did bring up bleeding as what I would monitor you for, but you also need to be careful not to cause bleeding upon yourself. Um, Good hand hygiene. You're going to try to avoid crowds, and the crowds just go along with where the immune system could be compromised, bigger crowd, more germs, things like that. You just want to try to keep yourself safe as possible while taking this medication. You also want to make sure you don't form any ulcers in your mouth. You want to, pay attention that if you're feeling full and you know that you're not necessarily full, but you have like a full feeling, that is a concerning sign. You also want to monitor having a low appetite. You also want to just pay attention to make sure that you're not forming jaundice, which jaundice is just the yellowing of typically the eyes, the skin, which can indicate a renal issue. And that is something that we want to stay away from and stay in the clear of. So that on your end, it sounds like a lot, but we just want to keep you as safe as possible and have you as comfortable as possible while starting this new medication. Sound like a plan? Woo! Oh gosh, nurse song. It sounds like a mouthful, but at this point, I'll do anything so that way I feel better, because I've really been miserable the last 3 months or so. So, sounds like a lot, but the only way to get through it is to do it. So thank you. So before Abby left, she was given one of these, which is like a little brochure pamphlet type of thing of the do's and don'ts to do with the medication. She did get a copy.